everyone. It's a little while I haven't been here, but I'm happy to be here this evening. Okay, it is. I look at the I look all around me. It's interesting. Now this is my talk or my little excerpt, I would say, for this evening. Actually, I've been away for a while. So I'm just coming back now and I'm just about to share a few tips to my new nurse. I want to say congratulations to my new nurses. I just got some news of some new nurses. Nurses, welcome on board. Welcome on board. All right, I have retired a few years now, but I still have that passion. I still have that passion for and compassion, you know. And I want to share a few tips I know my new nurses might experience. I would say the fair roller coaster in my book, Nurse, the Guide to Empower New Nurses in the Delivery of High Quality Care to All Patients. In my book on page 30, I do have some suggestions for fares. And of course, it's normal. So, my young nurse, that's a part of the journey. Okay. So, nursing is a profession of service, both in ordinary and extraordinary situations. So, some of the fears that new nurses usually encounter are fear of the unknown. What should they expect? What type of reception will they get from the family, from the patients? And what type of people and personalities will they meet? Okay, will they be able to give report to the colleagues or the doctors or any other member of the interprofessional team? These are some of the things that the fears that they experience. Fear of making any error. You want to do so well. You don't want to have any medication error. You don't want any to injure anyone. Fear of lawsuits. Uh, what will happen if I'm sued as a person? Fear of speaking to the doctors. Some doctors might seem intimidating, and so the nurse might fear that one, but not that one, if you know what I'm talking about. Yes. And fear of being bullied by senior nurses because you don't have that experience sometimes. Some senior nurses, notice I underscore some, are not as, some of them don't remember. You would think that they were new at some point. But for those who remember, they're very helpful to the new nurse. And fear of delegating task. Yes, that happens. Fear of delegating task. Especially some of those nurses who were, started from senior PT, PCTs or PCA, and they're at school, but sometimes some of them, they got a job in the same area where they were, where they practiced in that capacity. And now they have to delegate to some of their then colleagues. So they find that can be very challenging sometimes. They might want to do the work that or the task that they should have delegated. However, that might take some time, but you have to remember that you have a different role to play at this time. That doesn't say you won't be able to handle bedpan at intervals. No, that's not what I'm talking about. I'm talking about you taking on the job or the work of the PCA or the CNA instead of doing your other job or work or task that as a different level. Okay, so bear that in mind. Don't be intimidated by not wanting to make the right decision in delegating according to the needs. Uh, Fear of not being accepted, the relatives, the perception of individuals, colleagues, um, wanting to know if fear of wanting to make sure that you're meeting the time frame of meeting the objectives that are set for a certain time frame. Fear of time management. Well, I must let you know that time management is one of those that tend to be more challenging. You have to work within certain time, but that also takes practice. That also come with time. So you should be organized, and that will help, of course. But prioritize all those factors definitely should be on top of the list, but it will take time for you to be able, as you remember, from novice to proficient. So that period of time you grow as you gain more experience. Proper documentation, you want to make sure that you document. And the family, fear of learning fast or quickly. Some individuals learn faster. That was human. We are human, and faster than others. But make sure you're not the last one. So you have to, if you realize that you're slowing up, you have to put out some more effort. You have to maybe spend some more time in planning and organizing and prioritizing, and ask for help if help is needed. Okay. I would say fear of participating in a code. That itself can be a little challenging because that's why you're going to practice where to find, notice where things are located. Sometimes you have to have a little hunt. Um, Make sure you know where things are. Orientate yourself. If you don't get a thorough orientation, you should take your time for yourself and go and make sure you're aware of the location of different devices, yeah, different instruments, and so forth. So very, very important to make note of that. I am encouraging you to get a copy of this book. It's on Amazon Nurse, The Guide to Empowering New Nurses in the Delivery of High Quality Care. Now, I've had over 4 decades of nursing, and many of things that I've learned along the way, and my friends, my experience, my colleagues, and of course, advanced nursing, in addition to basic, have helped me along the way and have awarded me distinction in different areas. So, awards. So I just want to let you know I've shared many of these experiences, I've shared some skills, and of course, if you want to connect with me, you can come on YouTube. Yes, YouTube at Miriam Amanda Smith. You can subscribe. You can follow me on Instagram, podcast, Mary. And of course, podcast is Empowering New Nurses. Now, this book is on Amazon, both in Kindle form and on paperback like this. So share a copy, get a copy, share it with others. Look at the testimonials, and you will see it's a good book to have in your keeping. I would say, look at the testimonials and listen. Listen. All right. Look forward to seeing you. And if there's a topic you would like us to discuss, please feel free to do that. I appreciate you. Take time out to listen. And I promise I'll be coming more often this year, 2025. And of course, my webinar will be coming up and my workshop. So look forward to seeing you on EKG, culturally congruent care, and of course, some basic things. When you come on a scene, yes, yeah, you are BLS, CPR. Now, make sure, certified, make sure, first thing you're going to do is check for safety. Be great. Bye bye. Check for safety. Anything could be happening. Check for safety. Have a great one. Bye bye.